This is Dr. Mia Chorney with sleep topic number 2, and this has got to be one of my faves, the increased risk of cardiovascular disease, or let's call it heart disease. One woman dies every 80 seconds in the US, so sleep is important. So some of the things that we know that are important, that when you have a lack of sleep, you end up with increased blood pressure. When we go to sleep at night, our blood pressure naturally drops. We don't get enough quality sleep. Then our blood pressure is consistently higher. We call this the silent killer. So it's very important. It's a major contributor to heart disease. We know number 2, that poor sleep contributes to inflammation. And when we're under this inflammation, this can increase our risk for atherosclerotic plaque so that's plaque buildup within our blood vessels. And so chronic sleep leads to chronic inflammation. The next thing is we know it causes hormonal imbalances when we have chronic lack of sleep. So when we're thinking of our cortisol levels, our hormone levels, our insulin levels, so we can have increased heart rates, we can have increased risk of diabetes, increased blood pressure. And then when we have, the hormonal imbalances, we can end up with a disruption for people for weight gain, for metabolic syndrome, which then increases the risk of heart disease. Finally, we know that sleep disturbances can contribute to arrhythmias. So sleep apnea and other conditions increase your risk of atrial fibrillation. So does increased weight gain. But sleep is critical. Our body and our brain need to rest. And there is literature now looking at sleep or lack of sleep thereof, increasing our risk of elevated cholesterol. And we know that our cholesterol elevates with menopause as it is. So please, I hope this was a great tip for you.